Dr. Kevin Kavanagh comes in once a month and talks about all things related to healthcare and the healthcare industry. And we don't want to give him the big head, but I have to say he knows more about this stuff than anybody I know. And Kevin, good morning.
Oh, good morning, sir.
Well, it's good to have you here this morning. And you have a guest. Please introduce us to your guest this morning.
Yeah, I'd like to introduce Dr. John Santa. Dr. John Santa is here representing ABIM, which is the American Board of Internal Medicine Foundation, on the campaign of Choosing Wisely. He actually has two hats. He's also the medical director of the Consumer Union Healthcare Rating System. So if you go on Consumer Reports and see the ratings of hospitals or doctors, he's the gentleman who's in charge of it and the mind behind the whole system. So
Dr. Santa,
we're very privileged.
Good morning, sir.
Good morning.
Thank you so much for being with us.
Yep, glad to be here.
Where are you, by the way?
Well, I'm in a little bit better shape than you are, maybe. I'm in Yonkers, New York, so it's 17 here. And, you know, we're anticipating the next wave of storms, which you'll probably get 12 to 24 hours before us on Wednesday night, Thursday.
I'm just thankful we're not in Atlanta. Those poor people down there are going to get blasted, and they know less about how to drive in this stuff than we do, and they don't have the equipment to remove it like you guys up north have, and so it's going to be a mess. Get us started here, Kevin. What kind of question? Before we go, Kevin is a founder and member of Health Watch USA. Tell us what that is.
Yeah, that's a 501c3 organization dedicated to healthcare transparency. In other words, knowing what healthcare quality and costs are, and that's very important. And that really dovetails right into this campaign of Choosing Wisely. This is a campaign that is from the American Board of Internal Medicine Foundation. It is not some left-wing, activist type of a thing. This comes out of mainstream medicine. There are problems in medicine. I think many people woke up today to the headline story or to the story about Kentucky Labs settling a big false claims case of allegedly ordering $15 million $0.75 or whatever of unnecessary lab tests for drug testing. And so people do need to be very careful. And I think that maybe the first area we should look at are kind of just the 5 questions that need to be asked or people should be thinking about whenever they seek medical care.
You've taught us on this show that we do need to shop around for not only for doctors but for procedures and all that kind of stuff, and I just don't think we are used to that kind of thing, Dr. Santa. We're not. I'm used to shopping for a car but not for my health care.
Well, that's right. I mean, sad to say, this is not the health system that our parents and grandparents had. This is a health system that is one of the largest industries in the country, and it's a health system that here at Consumer Reports, our concern is constantly advertising and promoting, and so the consumer needs to be aware that they're on a market playing field, if you will. And we believe in markets in this country. We just believe in them when consumers are getting a fair shake and know what they're doing. So in health now, consumers need to step up to knowing everything they can about what they're buying. And they are buying health care on almost a daily basis these days.
Yeah, you're right. And we just have to sort of change our thinking. Now, I've been provided by Dr. Kavanagh with these 5 questions to which he referred. And the first one is, do I really need this test or procedure? As a doctor, you both are doctors. You wouldn't be offended if I said, you told me I needed this, and I said, do I really need this?
Well, I wouldn't, and I think that doctors need to step up to that if they would be bothered. I mean, what's remarkable here, as Kevin said, is that more than 50 of the country's professional medical societies, the societies that represent virtually all the doctors in the country, have acknowledged that there is widespread over-testing and over-treatment going on. Many people think it's as much as 30% of the time when we're tested or treated, we actually don't need it. I think most of us would say, really? I mean, I thought my doctor was getting it right all the time. Or let's say, well, maybe 5% over testing or treatment, just to err on the side of making sure, well, that'd be okay. But 30%, when you're talking billions of dollars, is way too much.
Yeah, and one of the big problems that I think that we all think about, but really we need to change the way we're thinking, is when you say my doctor. Because so many times now the doctors are employed by a bigger healthcare institution or company, and they're really working for the company, and they're on production quotas. It's not like you're going to the doctor that he has his own office. He's seeing you. He's completely independent, and there, I think it's more apt to be my doctor as opposed to now. It's similar to these big corporations, Walmart, etc.
Production quotas makes me shiver.
Yeah, well, and there have been reports of that around the nation. I mean, this is a national problem. It's not necessarily Kentucky. Lexington, I think, is very good. We've got very good 3 healthcare systems in the town. But this is a problem that is nationwide. With the changing of the system, we're going to these large, what are called oligopolies, very big corporations. The doctors are becoming all employees of hospitals, and they'll maybe under some pressure to channel you into their hospital system, or maybe the test costs more than the independent across the street.
Dr. Santa?
Yeah.
Agreed. All right. So when you say that they're working for big business, I'm thinking of this boardroom where they're saying, we need to do more EKGs this month. Let's get those numbers up.
Well, I should say, I'm a general internist. I practiced for about 25 years in Oregon, and listen, I looked at my monthly production figures, and I could see that when I ordered EKGs, that accounted for about 2-3% of my income. And they were easy to do because I would order them, someone else would do them. Later in my career, there would be a computer interpretation, so I just really needed to look and see if I agreed with that. And it would be a pretty straightforward additional $75, $100. I could tell the difference when I ordered more tests that I would get the income for. We have a system that has gone overboard in rewarding doctors, hospitals for doing more. And I think, again, we wanted that a bit, but I don't think we wanted it this much. And so the question is how to adjust.
Yeah, we got Dr. Kevin with us this morning, Dr. Kevin Kavanagh, and on the telephone, Dr. John Santa, American Board of Internal Medicine and Medical Director for the Consumer Union's Healthcare Rating Center. And let's go to the phones now, and this is Jim. Jim, good morning. Jim, are you there?
Good morning. You're talking about this?
Yes.
Jeff, that's okay.
Jeff, I'm sorry, Jeff.
That's all right. Hey, look, Doc, thank you for taking your time to help educate us. I've got 2 scenarios that have recently happened to me, and I just want to let you get your thoughts on those. I know the healthcare system right now, you're telling us the things that you see wrong with it, so you can imagine how confusing it is and frustrating it is for the consumers out here who don't have a medical background. For example, my wife has an internist or a general practitioner that she goes to once a year for a large provider here in Lexington for her annual physical. And she has to be careful when she is in there having that physical done that she does not ask a question of the doctor. Because any question that she asks, they write that up with another diagnosis and another chart. So when we get the bill from the insurance company, the explanation benefits, we look on there and we see all these different charges now that we've got to pay. And we look at it and say, what is all this? And she said, well, I asked him if I'm supposed to take vitamins. Or I asked him about this dry patch of skin I have on my leg. And each one of those, he's marking up as a different procedure to increase his production, as you talked about earlier. So that's very frustrating for us when that kind of thing happens. The second thing that happened to us back in December is that my wife had some cataracts removed, and I tried to find out what it was going to cost to have that operation done. And I could not find out for the life of me what was going to be my out-of-pocket cost, because when I talked to the provider, they said, we're going to submit it to your insurance company, and this is normally what we bill. We'll call the insurance company and say, well, how much am I going to have to pay? Well, we don't know until the claim is submitted. It's kind of like you have to pass this bill before you can see what's in it, kind of thing. So you can see those kind of frustrations that we have here at the consumer level.
Okay, it's really wonderful questions, Jim. We've got a little bit of a funky line, so I'm going to hang up on you and let you listen to the answers off the air. Is that okay?
That's fine. Great. Right. Thanks.
Thank you, Jim. Dr. Santa, first of all, that every time I ask a question, I got another diagnosis and another bill. What do you say to that?
Yeah. Well, first of all, I have strong feelings about this because I'm a primary care physician. I believe in screening people for problems and believe in prevention. And when prevention works, it's a fantastic thing to do. But unfortunately, what the program we're talking about, Choosing Wisely, coming out of the ABIM Foundation, has shown is that multiple screening efforts, including annual physical exams, are being overdone. The Society of General Medicine urges that we rethink how often an annual physical exam is being done for reasons much like what the listener reports, that a variety of things end up being done, tests being ordered, treatments being ordered that are oftentimes not needed. In many cases, we're over-screening people for heart disease and for cancer, and it's resulting in a lot of misleading results that can result in procedures that we don't need. So consumers, if they're healthy and they're not at high risk for problems, need to be a bit wary of routine screening and testing for disease. There's some very good tests for heart disease, for example, screening for high blood pressure, cholesterol, diabetes, and some very good tests for cancer, screening for colon cancer, breast cancer, cervical cancer, all in the right circumstances, but it can be overdone.
Kevin, do you have a comment on that before we move on?
Well, yes. I just think one of the things, this is a good illustration of what our healthcare system is changing to, because a lot of times it's not necessarily the doctor that is doing that, but as he's entering this into the medical record, the computer is automatically ticking off things that it can bill and essentially get away with.
I see.
And one of the big things that's happened when the change over to electronic medical records, remember this is probably some huge corporation he's working for, is that the costs of medicine have gone up extensively because it is picking up every little nitpick thing that they can that they could squeeze out a penny for, and that is I think a huge problem, because my experience as a patient is sometimes you'll go in, the doctor just stares at the computer screen, gives you 2 minutes, and then winds up giving you a level 4 visit charge.
Yeah.
And that's kind of frustrating. And if that does happen to you, the best thing I think to do is try to find yourself a doctor that doesn't do that.
Can I make one comment?
Sure. Yes.
Yeah, it's also possible to program those records the other way. In a Choosing Wisely program in Los Angeles, a physician named Scott Weingarten at Cedars-Sinai is programming their electronic record such that when doctors order many of the tests that are being overdone, the record says, whoa, wait a minute. Do you know that it doesn't look like this test is needed here? Why are you ordering it? So it can work both ways. What we need to do is get the system to focus on doing it just right, not doing it to make the most money, but doing it just right.
Call the insurance company and say, well, how much am I going to have to pay? Well, we don't know until the claim is submitted. It's kind of like you have to pass this bill before you can see what's in it, kind of thing. So you can see those kind of frustrations that we have here at the consumer level.
Okay, it's really wonderful questions, Jim. We've got a little bit of a funky line, so I'm going to hang up on you and let you listen to the answers off the air. Is that okay?
That's fine. Great,
right.
Thanks.
Thank you, Jim. Dr. Santa, first of all, that every time I ask a question, I got another diagnosis and another bill. What do you say to that?
Yeah, well, first of all, I have strong feelings about this because I'm a primary care physician. I believe in screening people for problems and believe in prevention. And when prevention works, it's a fantastic thing to do. But unfortunately, what the program we're talking about, Choosing Wisely, coming out of the ABIM Foundation, has shown is that multiple screening efforts, including annual physical exams, are being overdone. The Society of General Medicine urges that we rethink how often an annual physical exam is being done for reasons much like what the listener reports, that a variety of things end up being done, tests being ordered, treatments being ordered that are oftentimes not needed. In many cases, we're over-screening people for heart disease and for cancer, and it's resulting in a lot of misleading results that can result in procedures that we don't need. So consumers, if they're healthy and they're not at high risk for problems, need to be a bit wary of routine screening and testing for disease. There's some very good tests for heart disease, for example, screening for high blood pressure, cholesterol, diabetes, and some very good tests for cancer, screening for colon cancer, breast cancer, cervical cancer, all in the right circumstances, but it can be overdone.
Kevin, do you have a comment on that before we move on?
Well, yes. I just think one of the things, this is a good illustration of what our healthcare system is changing to, because a lot of times it's not necessarily the doctor that is doing that, but as he's entering this into the medical record, the computer is automatically ticking off things that it can bill and essentially get away with.
I see.
And one of the big things that's happened when the change over to electronic medical records, remember this is probably some huge corporation he's working for, is that the costs of medicine have gone up extensively because it is picking up every little nitpick thing that they could squeeze out a penny for, and that is I think a huge problem, because my experience as a patient is sometimes you'll go in, the doctor just stares at the computer screen, gives you 2 minutes, and then winds up giving you a level 4 visit charge.
Yeah.
And that's kind of frustrating. And if that does happen to you, the best thing I think to do is try to find yourself a doctor that doesn't do that.
Can I make one comment?
Sure. Yes.
Yeah, it's also possible to program those records the other way. In a Choosing Wisely program in Los Angeles, a physician named Scott Weingarten at Cedars-Sinai is programming their electronic record such that when doctors order many of the tests that are being overdone, the record says, whoa, wait a minute. Do you know that it doesn't look like this test is needed here? Why are you ordering it?
Oh.
So it can work both ways. What we need to do is get the system to focus on doing it just right, not doing it to make the most money, but doing it just right.
Are there simpler, safer options, such as ultrasound-guided injection instead of an X-ray guided, or thyroid ultrasound versus a radiological test?
Yeah, that's a great one, because oftentimes if a child or young adult is in the emergency room and it looks like they could have appendicitis, the safest option is to do an ultrasound. But that may not be the easiest option, and so a CT scan, as Kevin's described, gets done, and the person gets radiated because of the CT scan, when they should get the ultrasound technician in and do the safer, simpler procedure. It's another great Choosing Wisely topic.
Yeah, and I'll give you a vignette, and this happened to me, and this was after my 3rd neck operation. Very long surgeries, a lot of scarring in there. And a month or a week later, I had a huge flare-up of arthritis. I thought it was gout. Every joint started swelling. I had to be hospitalized. And during the hospitalization for my arthritis, completely unrelated. They said, well, we need to get a X-ray of your neck. Make sure you don't have a neck abscess from your surgery. And I was a little bit reluctant on that, but I finally said, okay. So they got the CT scan, and they came up to me and they said, well, you have a thyroid nodule. We want to biopsy it. And I said, well, no, I'm pretty sick now. I don't need a thyroid biopsy right now. Thyroid cancer, in my experience, is something that either A, it's very benign and slow growing, or B, it's anaplastic and it just ravages you and eats you alive, and no matter what you do with it, that's it. And so I refused to have that done, and they got quite upset, and they said, well, you really need to get this done. This is quite a large nodule. And I said, well, yeah, but I said, now, a month before my surgery, just last month, I had an MRI scan, and it wasn't there. And I said, what lobe is it in? They said, it's the right lobe. And I said, well, maybe that's just a hematoma in the center of the thyroid from the retractor that was on it for 6 hours. And they kind of thought, said, oh, yeah, that's right. So what we'll do is we'll schedule you in 6 months for a CT scan when you come back to make sure it goes away. And I said, well, what about just getting an ultrasound in 6 months? And they said, oh, okay, we'll get you ultrasound. So they got an ultrasound in 6 months, and, the thing was gone. And that's kind of a thing where, and of course, that would require, some medical knowledge to do that.
I was going to say, I wouldn't know to do
any of that. You can't do it, but don't think doctors are immune to that. It was an unnecessary biopsy, then an unnecessary CT scan, which we then got, down to an ultrasound.
And what would that have eventually cost, you think, if they did all this stuff?
It would be several $1,000s plus, exposure to radiation, plus having a needle in your neck when you're hurting, sick, and in the hospital for something else. It's crazy.
Down to our final segment here this morning with Dr. Kevin Kavanagh in the studio, along with Dr. John Santa on the phone. And back to your calls. This is BJ. Thanks for holding, BJ.
Good morning. You're welcome. My question is about these knee injections as lubricant, and it says it could make knee replacement obsolete. What's your opinion on that?
Well, let me answer that, because that's kind of a medical question. We're seeing a lot of this in Kentucky in these advertisements. I'm not an orthopod. I haven't reviewed the literature, but I sure would get a bunch of opinions.
Get a little close to the mic.
I would sure get a bunch of different opinions on that. I'm just a little skeptical of that. I'd be very, very careful.
Be cautious.
And be cautious, yeah.
There's a lot of advertisement on that. Well, I asked my orthopedic doctor, and he says no, and I asked my regular doctor, and he says no, it's not like it's advertised. But there's a lot of advertisement. I think even on this station that's advertised.
Yes, it is.
Yeah, and we kind of, touched on that a lot of times you'll get X-ray, CT scans, all sorts of things. I've seen CT scans for dental exams. And, that is something I would be quite cautious on. It's not really standard treatment. I mean, even the standard treatments of the knee joint surgeries and hip surgeries have tremendous amount of problems. So I would be very careful.
Yeah, BJ, thanks. I appreciate your call. Let's continue our list here, and we've got 2 more questions to cover. Number 4, what happens if I do nothing? Will it make any difference? A question we should ask.
Yeah, this is John Santa. This is especially important because the natural history of many diseases is to get better on their own. For example, most people who have back pain from a muscle strain or sprain or muscle spasm, the chances are 95 out of 100 that they will be better within 6 weeks if they do nothing. And in fact, it turns out that if they get an early imaging test, it's more likely they'll have surgery because the imaging test will generate a false positive. All of us over 55 have findings in our back. We have a little arthritis here and there. We have some narrowing. So when it comes to low back pain that isn't showing any worrisome signs, and a competent physician can figure this out. The best option is to do nothing.
That's interesting, because about 3 weeks ago, like an idiot, I'm 61, and I decided I was in great shape to go out and shovel snow, and shovel quite a bit of snow, and I couldn't hardly walk the next day because of lower back pain. Now, I could have run to the doctor, but I just figured it was being 61 years old and being stupid, and you're right, in just a few days, it was gone.
That's right.
Okay. The fifth question of our 5 questions. How much does it cost? Because prices can vary as much as 5-fold for the same exact test.
Well, that one's important now because, unfortunately, it's not only our health that's at stake, but our personal fortunes. Consumers need to know, as we've talked about earlier in the show, that it doesn't take very long before what we're responsible for paying adds up. Many of us now have much higher deductibles, much higher out-of-pocket costs, and the rules of insurance are tricky, and we may be in a setting where the insurance company isn't going to pay as much as we think. So we really need to be cautious about what kind of bill am I running up here before we go too far.
Kevin?
Oh, yeah, that's absolutely correct. When you talk about the healthcare reform and the exchanges, everybody talks about premiums. And a lot of those premiums are based on the bronze plan. Even if they're based on the silver plan, you have a huge, substantial amount of what's called deductible that you have to pay up front before the insurance will kick in. So more and more people are starting to shop and do comparison shopping, and that is going to be key.
One more question that we've talked about on the show numerous times in the past, but we're going through cold and flu season here now, and that is those are antibiotics, and how we as consumers have decided that they fix everything, and therefore we go to the doctor and we insist that the doctor give us one, and he writes a prescription for them.
Yeah, that's a huge problem. Now, in fairness to consumers, I'm old enough to remember the days when drug companies and doctors advertised and promoted antibiotics for everything. Well, consumers still believe that. But now we know that overusing antibiotics is resulting in the emergence of resistant strains that, this is serious stuff, are killing people and actually could result in some of our hospitals being very unsafe, if not closing. The National Institutes of Health almost had to close their hospital in Bethesda because of the emergence of a resistant strain. We got to work with each other here. This is one of the hardest things for doctors to get patients to be patient with. If you don't have serious signs of a bacterial infection, the best option is to sit tight, treat the symptoms. If they don't get better or you show additional symptoms, then antibiotics are appropriate. In the meantime, be patient.
Dr. Santa, thank you so much for being with us this morning. We really appreciate it.
Well, thank you very much. And I just want to, emphasize what he said, antibiotics, bacterial resistance, and we really need to be careful on that. Only take them when you absolutely need to.